Hi everyone, my name is Hannah and today we will be providing this patient care by doing a sterile wound dressing change. Okay, so like all my videos, if you haven't noticed, I'm mostly going to be talking to you as the learner, but never forget, always do patient identification, allergies, all that good stuff, and walk your patient through any procedure that you're doing so there's no surprises. All right, so with this patient, they have an abdominal wound. Going to keep them covered as much as we can. We're going to expose that wound. I will have already had done hand sanitizer, hand hygiene before applying clean gloves. These are clean gloves. Then I can open up my wound dressing change tray away from me. Remember, you can always touch the outer inch. And I'm just going to really carefully grab this trash can. Again, I'm not sterile at all yet. I'm still not going to turn my back on that wound tray now that I have it open. So I can touch everything. I'm not sterile. This is just a little trash can. Kind of set that up. Okay. I'm going to remove the old dressing with clean gloves. For the purpose of competencies, we are assessing your ability to stay sterile. So we are not having you measure the wound, and we are not having you clean or irrigate the wound. We are just taking the old dressing off with clean gloves, putting a new dressing on with sterile gloves. That's it. Okay, so now our dirty old dressing was taken off with clean gloves, and we're ready to set up our sterile field. So I just want to talk about the kit a little bit and what we have here. So outside of your kit, you're going to have a cotton-tipped wooden applicator. Here, I'll just take it out so you can see it. It's like a big Q-tip. Just be careful once they've been reused. It's kind of a little tricky to use the packaging, so just be careful with that. And then you have sterile gloves separate from your wound care kit because these wound care kits do not come with sterile gloves in it, and not all will. So just not all will in a practice setting. So just know that. Read what's on the kit on the front of the box first, but we know that yours doesn't come with it, so grab whatever size. Okay, then on the actual kit, you have, it actually says sterile field pickup here on your sterile drape. So when you're resetting your kit prior to comp or prior to practicing, make sure you always put it back together this way. And remember that the outer 1 inch is not sterile. So just in case I have forgotten to say it, make sure you wash your hands again before you put on your sterile gloves. And we're going to get this sterile field going. Okay, so again, there's still a few steps before we actually get sterile, but we're starting to set up our sterile field by touching that outer 1 inch. Outer 1 inch all around, away from you. Notice that it's going to hang off of the side, and that is okay. Just know that that part is not sterile. I'm reaching over just to show you, but you wouldn't do that. But this is all not sterile. You can only use this sterile field up here, but it's okay that it's hanging. Then you're going to take your cotton tipped applicator. You're going to pretend this is a brand new packaging. And what you would do is just open it up and drop. Okay. Next, grabbing the actual dressing kit. Make sure you grab this so it doesn't hang over and contaminate. Same kind of concept. You're just going to drop everything. Do not throw this away though. Keep it right here. The reason why you don't have sterile gloves on yet is because you still have to apply your normal saline. You wouldn't be able to touch this if you had sterile gloves on. Okay. So now you can move things around. Remember, you can touch that outer inch. So I'm going to try to give myself as much room as possible. Put my sterile gloves on because you're going to notice that this gets a little bit tight. So once you've poured in your normal saline and your sterile field is all set up, that's when you actually put on sterile gloves to begin your applying your new dressing. Keeping everything nice and up. Okay. So let's go over a little bit more. These simulation use only, you do not have to use. You do not have to use your pin. So what we're going to be looking for you to do, really simple, just to show sterility. Take your gauze Moisten it in the normal saline. Remember, I'm sterile. I can touch everything here. Squeeze it out. Just want it dampened. You're going to have to kind of unravel it a little bit. Okay, then we're going to come over to the wound. So then you can either decide to use your fingers or you can use this. And what you're going to do is grab the gauze and use the Q-tip to get it only on the wound itself. So I actually like to typically use just my fingers, so I'm just going to show you that. But it's not wrong to do it either way. I just tend to have a bit more control when I just use my fingers and the Q-tip. Okay, and then you would grab your other gauze and you would do this until you can't see the wound anymore. So the important part is that you notice that I just packed it in the wound. I'm going to show you something incorrect here. If I started packing it and touched the skin and then dragged it into the wound, that would be bringing dirty germs from the skin into the wound, and that would be a break in sterile. So just if you accidentally do that, just identify it and say you would need to start over from the beginning. Okay? So when it's finished and you have enough gauze to cover the entire wound, you'll know because you won't see any of the red wound red anymore, and you'll be ready to put the abdominal pad on top. Okay, so then once you're happy with how that's packed, drop your cotton tip applicator, grab the ABD pad, I think blue line to the sky, so blue line up, drop it. Now I'm wearing sterile gloves, right? But I don't have to be careful anymore because it's covered. So then I can take my tape around it, and then I can use these as clean gloves. I could have verbalized it. I would have a pencil. I would write on a piece of tape on the table the patient's, the date that it was changed, the time, and my initials. And then I take the patient. You would just never want to write on the patient's body. So you would tape it up, and then you're all done.